And the Zoom is a little bit delayed. I mean, the Facebook is a little delayed, so. Let me see here.
Is that cars I hear in the background there for you?
Yeah, I'm right off the road, so why did it do this? Oh my gosh, weird. Okay, it didn't. Okay, I guess we're live. Okay, we are live.
Yeah, I see a little icon that says live on Facebook up here.
Yeah, okay, so we're good. All right. All right, well, good morning, everybody. We're here, Vida del Norte. We're doing our coffee and conversation this morning. And we're live with Gilbert Valdez, who is a licensed clinical counselor. I'm gonna just go ahead and hand it off to Gilbert. He's gonna be discussing alcohol and the brain and what it does with the development, and I'll let him take it from here.
Good morning, everyone. My name is Gilbert Valdez. Like Maria said, I am a counselor, a therapist, independently licensed. I've been in the field for probably 9-10 years. I graduated from Eastern New Mexico University. Shout out to the Greyhounds. I've worked all over. I worked there in northern New Mexico for a while. I've lived in Taos, was working in Española and Veracruz and some of these other surrounding communities. I think the farthest north I went when I was working with team builders and Agave was Tres Piedras. So I have some experience with some of the community and culture up there. I've been all over the place working in New Mexico communities, different ones. Today, I'm going to be talking with you all about alcohol, some of the effects, long-term effects it can have on the brain, and as well as just the impact on development for children and adolescents. One of the things I'm going to be sharing is some slides that I've made from Instagram. Me and Maria were just talking about this before we went live. We've really turned to social media kind of as an education platform. And the people that follow me, I'll query them and say, hey, do you guys want to learn about this? Or I'll post something and they'll say, yeah, a majority of them will vote yes. And so one of those topics that I posted recently was about this idea of what happens to the brain when you drink too much alcohol. And so we're going to walk through that. And I'm going to show you some of the slides that we've created. And I think they're pretty educational. A part of what I've tried to do is make the information in bite size. This is a really complex topic, and we're definitely not going to cover everything that there is to know. We're going to talk about some risk factors, but these aren't all the risk factors. These aren't all the conditions that can possibly happen. We're really going to kind of zone in and focus on some more of the severe ones, at least for adults. So Maria, if you're ready, I'll go ahead and share my screen.
Yeah, I'm ready. Gilbert, will you go ahead and give me permission to record, because it's not allowing me to right now because I made you the host.
Okay, so let's see. Record to the cloud?
Sure.
Okay, now I see another one saying recording, so I think we're recording.
Okay, good. So we're good to go.
Okay. All right, so again, Gilbert Valdez, I'm going to be presenting on alcohol and some of its effects on the brain and developing brain. So let's go ahead and share our screen here. Let's see, will be recorded. Do not prevent, screen broadcast, photos. Does it say that? Okay. Enable do not disturb to prevent unexpected notifications. Okay, so let me do that really quick. Put on do not disturb. Good. Okay, so let's see, it's gonna say screen broadcast. Let's see what we got. Photos. All right, I don't think that's the thing I'm trying to share there, screen record. No. Maria, what can you see on your side there?
It's saying that host disabled attendee screen sharing, but you should be able to.
I push share screen content, And it gives me an option of photos, screen. I'm pushing screen. Zoom. Stop recording. Okay. Oh, that's really weird. Share content. Yeah, like I told you earlier, it's just really strange. Everything on your screen, including notifications, will be recorded. So I think we're already recording. Is that right, Maria? Yeah, I see a record button.
Yeah, and if we need to stop, we can. And then if you need to share and then record, we can do that.
Okay. And I'm just trying to share my content, my screen here, but I'm having a difficult time. Let's see, let me try again. Share content, screen, photos, iCloud, Dropbox, Microsoft, Google, Box, website URL, bookmarks. Screen. I'm having a difficult time here, Maria, because it's not giving me exactly what I want. I just want to share my screen, but it's not allowing me to.
Is it allowing you an option to share your desktop?
I'm on my phone and it's giving me an option to share like things, but not the things I want. So when I push screen, it gives me another option to share photos, Microsoft Teams, Verizon Diagnostics, and Zoom. Darn it. So let me try again. Let's just try something. I'll just pick photos. Let's see what photos does. Zoom would like to access your photos. Okay, don't allow. So that kind of worked. Screen. That is so weird. Do not disturb. Enable do not disturb to prevent unexpected notifications.
Just bear with us, guys. We're having some technical difficulties this morning.
Okay, so let's see if this works. You are sharing your screen. Okay. What can you see now, Maria?
I see your photos of your beautiful family.
Okay, is this the Instagram? Can you see it?
Yes.
Okay, so I think we're on the right place, folks. Thanks for waiting with us and being patient. So I've created this, again, kind of like a PowerPoint presentation in Instagram, and I'm gonna be sharing this all with you. All right, Maria, what do you see?
I see the brain. So yeah.
Okay. So what we're looking at here is a graphic, an fMRI of two brains. On the left there, it's a normal 43-year-old brain. And on the right, there's a person with alcoholism who's been drinking heavily for a very long time, same age as the person on the left. And what you can see here is there's basically a shrunken brain. We call that brain damage. We call that atrophy. The brain literally has withered away a little bit. So we're going to kind of go through this. So what I did was I posted this on my Instagram and I asked I got a lot of messages from my followers saying, hey, what is that? Or generating discussion. And usually when that happens, I'm like, okay, this is a topic people want to learn about. And again, I use my platform being a counselor to kind of educate that. So people said they wanted to learn about it. And here we are with Maria. So the colloquial name or the kind of the nickname for what we're talking about, this idea of like a smaller brain, an atrophied brain, is some people have called it wet brain. And you know, some of our family members in our life probably have had this condition. And we're going to talk about some of the symptoms. And so as I go through these, think back, like, do I know anyone in my family that may have struggled with this or is currently suffering with this? And the big kind of technical term for wet brain is Wernicke's-Korsakoff's syndrome. And so we're going to walk through these. There's a bunch of little cool graphics that I've put on these because I think when I'm trying to learn something, I don't like a lot of words. I want to kind of distill something down and it catch my attention. And so for every slide that we're going to go through, I've tried to do that. So hopefully it's helpful more than a distraction. But again, a part of what I'm also doing in some of this education is I'm kind of appealing to the younger generations that are on Instagram, at least that follow me, because you know we have short attention spans. You may have heard that, and so we're trying to kind of catch people's attention and hook them in to teach them something. So, Wernicke's encephalopathy, it's a big word, is a degenerative brain disorder. Sorry, caused by a lack of thiamine or the vitamin B1. It can result from alcohol abuse, dietary deficiencies, prolonged vomiting, eating disorders like bulimia or anorexia, or the effects of chemotherapy. So those conditions right there, there's something about them that depletes our B1 or our thiamine. And this wet brain idea, this disease that we're talking about is because there's a lack of thiamine in our system. Um, a lack of this can cause damage to the thalamus and the hypothalamus and certain structures in our brain. And the symptoms of this include confusion, mental confusion, vision problems, coma, hypothermia, low blood pressure, and a lack of muscle coordination called ataxia. So, not having thiamine in your system can cause a whole number of problems throughout your whole body, not just in your brain. Thiamine is an essential amino acid, a micronutrient, which cannot be made in the body. And thiamine is required for metabolism, including that of metabolizing sugar, glucose in our blood, amino acids, and lipids. So what's important also to know is that you can't get thiamine just your body making it. Your body doesn't make thiamine. So we got to get it from food and drinks, obviously outside of ourselves. Thiamine deficiency causes damage to areas of this brain. We talked about that, the thalamus and the hypothalamus. These structures in your brain, which are in the limbic system of your brain, kind of the mammalian centers of your brain that kind of make us the most human. This area regulates functions such as relaying sensory signals, motor signals. That's why you kind of have ataxia or maybe some shaking or issues coordinating your motor skills. And it sends signals to the cerebral cortex, as well as it controls sleep, consciousness, and alertness. And if you've ever had family members or loved ones that you know or friends that have struggled with this condition, Wernicke-Korsakoff, they have issues sleeping. They sleep really poorly, and they also have issues, just with memory in general. And we'll talk about that. Without the thalamus, the brain cannot diagnose sensory information transmitted to it. And so it also can regulate memory. All that area, the thalamus, the hypothalamus, is really close to other structures in your brain called the hippocampus, which store memory. And we'll talk about that as well. So if you are struggling with Wernicke-Korsakoff and you have a deficiency of thiamine, you may be getting information from the senses of your body, whether it's smell or sight or hearing something, but that may not be coded into meaningful information in your brain. And sometimes we'll experience that when we talk with people with this condition. They have a difficult time processing information or just holding on to that information in the short-term memory. And we'll talk about why. Also damages the hypothalamus. Its function include kind of a baseline for food intake, metabolism, feeling hungry, regulating your temperature, again, your circadian rhythm, which is kind of your wake and sleep cycle, and then your endocrine control, which is just how your hormones operate. So as you can see, if you have this condition, a lot of systems and functions in your body can be dysregulated. The person who is responsible for Wernicke-Korsakoff is also the man who discovered this part of the brain, called Karl Wernicke. He was a German physician. And Wernicke's area is really responsible for language as well as Broca's area. So we'll talk about some of that. Encephalopathy is just a big word for a disease in the brain. Okay, and I have a 2.5-year-old, and we watch a lot of Fancy Nancy, and she says things in in French, and this is kind of like a throwback to that, saying, encephalopathy is just a big fancy word for brain disease. So what is Korsakoff syndrome, also known as Korsakoff's amnesia syndrome? It's a memory disorder that results in, again, a deficiency in thiamine, vitamin B1, and it's associated with alcoholism. Korsakoff syndrome damages nerve cells and supporting cells in the brain and the spinal cord, as well as parts of the brain that involve memory. I put a little seahorse there because the Latin term for hippocampus is seahorse. Some of the symptoms of this condition include amnesia or forgetfulness, tremors, coma, disorientation, vision problems. The disorder's main features are problems in acquiring new information or establishing new memories or retrieving previous memories. Sometimes we'll have people with this disease show up in our emergency rooms, and they'll be withdrawing from alcohol because they haven't drank. Maybe they're trying to come off of alcohol and they're detoxing, or they're going cold turkey. and cold turkey can kill you from alcohol. And they'll show up and they'll be in pain. They'll be withdrawing. They'll have tremors, DTs, and some people they will have psych issues, like they will be seeing things or hearing things. And so that really tells us that this is a severe case of this condition, because it's really messing with their normal functioning. So both Wernicke and Korsakoff's are caused by a deficiency in vitamin B1 or thiamine. Together, they make the brain disease Wernicke-Korsakoff syndrome. So I queried my followers, like, why do people with alcoholism have a vitamin B1 deficiency? And I'd ask you, why do you guys think people, if they're really drinking alcohol a lot, high amounts, a lot, all the time, for a long time, why isn't there vitamin B1 or thiamine in their system? Some people answer that question with difficulty absorbing B1 and other vitamins into the body. That's correct. Excessive alcohol use equals inflammation of the stomach lining, which equals poor vitamin absorption. It's also correct. And we'll talk about why. So thiamine deficiency is common in drinkers who consume excessive amounts of alcohol. This is due to poor nutrition, number one, and the diet that they do eat doesn't contain enough essential vitamins, and the inflammation of the stomach lining due to excessive alcohol consumption, which reduces the body's ability to absorb vitamins. So inflammation of the stomach, we've learned a lot as scientists have studied what happens in our gut and our digestive system when we have certain things we put in our body. Gluten and high fructose corn syrup are main drivers of inflammation in our stomach. And when our stomach is really upset, like I like to call it kind of like a on fire belly, your stomach's not happy with you. And your stomach is a smooth muscle, so it has the same properties as other muscles. And like when you get a boo-boo on your arm, your body will react with an immune response to swell or get inflamed, and that's sending a lot of blood to that area with certain white blood cells to fix whatever insult is going on in there, whether it's like a bacteria or a virus or something like that. The same thing can happen to our stomach. So if our stomach is upset and it's inflamed, it may not be doing its normal thing, which is absorbing nutrients as well as water and breaking down food. So thiamine deficiency also causes a kind of a vicious cycle. If you don't get thiamine, you can lose your appetite, so you're not hungry in the first place. Maybe you have constipation, you kind of have problems in your stomach where you feel like you need to go take a bowel movement, but you can't. You get fatigue and muscle weakness. So a person's gut may be on fire, inflamed, which reduces its effectiveness. In general, people that have kind of alcoholism don't eat enough in general. They skip meals, they sleep through meals. When they do eat, they don't have a lot of energy to make really good food. So they eat kind of crap, and I've kind of put a bag of Doritos in there. It's kind of anything that we would consider kind of junk food. And then even if you did eat, all that's happening, maybe you can't even go poo. So it's really a nasty cycle. And if you've ever been, constipated or having issues with your stomach, eating sometimes hurts. So like we said, the people when they are drinking, maybe they'll drink themselves to sleep, they'll pass out. And when they do wake up, it's not to make a 3-course meal of, pasta carbonara or something with some good bread and some good liquids. So let's look at this graphic again. We've learned a little bit about Wernicke-Korsakoff, and let's come back to this graphic and kind of apply it. So as we look at the graphic on the right, the shrunken brain, we can see the extent of nerve damage. The brain literally is wasting away or atrophying. And, if we were making good choices with a healthy brain, or we were making poor choices with a healthy brain, imagine the kind of choices that we would make in life if our brain was smaller, if it was not working effectively, if we didn't have all the effective tools and capacities that a healthy brain has. So what is the definition for atrophy? Literally a body part which are no longer required gradually wastes away. Okay, so someone asked, Gil, I do drink alcohol on the regular. Does this mean I need to slow down so I don't end up with wet brain or Wernicke-Korsakoff's? So my answer to them was, assuming you're not consuming alcohol at disorder-like levels already, you could hypothetically continue consuming alcohol on the regular while ensuring you are getting adequate vitamin B. Remember, this condition that we're talking about, wet brain, is because of a deficiency in vitamin B1. So what is thiamine is naturally present in some foods, including, and there's kind of a list here. So hypothetically, you could continue to um, use alcohol and get enough vitamin B1, and you should be okay, you know. But again, there's other issues that come up with drinking alcohol in life, where eventually we stop eating, or like we talked about earlier, we our stomach gets upset and inflamed, so we stop eating healthy stuff. Maria, do you got any questions so far?
Not so far, Gail. Like you could go ahead and keep going.
Okay, I'll check in periodically. But again, you know, you'd want to talk with your primary care physician, anyone, medical professionals that you're working with, in terms of like your intake of food, and if you are consuming alcohol and you are getting treatment for consuming alcohol, you know, you're going to want to work with your providers to say what is the best course of action for me. Doctors, for the most part, or medical professionals, they'll be prescribing thiamine, just the vitamin in general, as well as other things if you are struggling with this condition. We got to replace that vitamin B1. So it begs the question, what's considered disordered level alcohol consumption, and does it lead to wet brain? People are maybe really wanting this answer, right? So a story first. I had an uncle who used to proudly claim that he only drank beer every day. He didn't drink any water. And it was really a strange accomplishment for him. He lived in northern New Mexico, lived on a ranch with the rest of my family. And you know, the last time I saw him, maybe 10 years ago, we were visiting the family up there, and it was really sad. I went to go visit him in his trailer. He lived alone, and he recognized me, and he could kind of gesture and make some noise and kind of get some sentences out, but he really couldn't really put sentences together. He was really, you know, flaco. He was really skinny. He kind of looked kind of wiry, and it's the worst that I've ever seen him in his whole life, sadly. He passed away soon after that, but it's a strange existence to just be drinking that much. You know, that's kind of a big thing that he looked forward to every day. So, you know, rest in peace to my uncle Whitey. It's really sad, and it's, you know, for those of us that come from families where alcoholism and drug addiction is a thing, it's part of our kind of our fabric of our family and our culture. You know, we probably have seen these conditions and some of the functional problems where people are struggling with alcoholism on a daily basis. You know, and I know we all probably have stories like that. So we turn to the DSM-5 for what alcohol use disorder looks like. What are the criteria to be considered clinically that I have a quote unquote alcohol problem? And it's defined as such: a maladaptive pattern of substance use leading to clinically significant impairment or distress, as manifested by two or more of the following occurring at any time in the same 12-month period. So if you go to a counselor or a drug addiction specialist, and they're going to try to figure out if you have this problem, they're going to say within the last year, the next criteria, did you struggle with either of these, two of these at least, and did it cause problems in your life that was significant enough to go into a mental health therapy place or a drug addiction rehab, um, because it's causing problems, you know? And I've heard people say, well, drinking isn't a problem for me, it's a problem for other people in their life. And you know, if your loved ones are kind of beating you up because you drink too much, or they're telling you that you need to slow down, or you're waking up and you're having alcohol or other drugs right in the morning to kind of get you awake, you know, those are indications that there's a problem potentially. So here are some of the criteria. Alcohol is often taken in larger amounts or over a longer period of time than was intended. There is a persistent desire or unsuccessful effort to cut down or control alcohol use. A great deal of time is spent in activities necessary to obtain alcohol, use alcohol, or recover from alcohol. I guess that'd be hangovers. Craving or a strong desire or urge to use alcohol. Recurrent alcohol use resulting in a failure to fulfill major role obligations at work, school, or home, right? Daddy couldn't take me to school because he was drunk, things like that. Mom's calling in for dad because he's drunk or he's having a hangover. He can't go into work. Continued alcohol use despite having persistent or recurrent social or interpersonal problems caused or exacerbated by the effects of alcohol. That reminds me of a quote by Homer Simpson. He said, alcohol, the solution and problems, or solution and cause of all my problems. Important social, occupational, or recreational activities are given up or reduced because of alcohol. Recurrent alcohol use in situations in which it's physically hazardous, so maybe drinking and driving, maybe you're operating heavy machinery, maybe you're you know, shooting guns, something that could potentially be physically dangerous. Alcohol use is continued despite knowledge of having a persistent or recurrent physical or psychological problem that is likely to have been caused or exacerbated by alcohol. Tolerance as defined by either of the following. So you have an increased tolerance, which means you need to drink more to have the same effects. A need for markedly increased amounts of alcohol to achieve intoxication or desired effects. A markedly diminished effect with alcohol use of the same amount of alcohol. So the way our bodies work and our nervous systems work is this thing called habituation. If you do something on a long enough time scale, your body gets used to it. It gets habituated to it. You know, for some of us, let's take it to another example. We all wear clothes, but we don't feel the tags on the back of our shirt because our bodies have become habituated to that stimuli. And so over time, maybe we have an issue with tags on our shirts or our clothes, but over time we stop feeling them. So, our body will become used to these things. Withdrawal, as manifested by either of the following: the characteristic withdrawal syndrome for alcohol, delirium tremens, some of these other things, nausea, cravings, or a closely related substance such as a benzodiazepine. We will prescribe people Librium and other benzodiazepines to help them withdraw symptoms, because withdrawal is very painful and it really sucks. You feel very sick. And so you take those. So again, if you've experienced any of these criteria in the last 12 months, you potentially could be struggling with what we call alcohol use disorder, or AUD. You'll see in the slides. Maria, any questions, comments about any of those things?
No, how much more do you have, Gil?
I'm halfway. I can keep going through though. Do you want me to move forward?
No, I just was curious. I'll wait till the end and then I'll ask a few questions.
Sounds good. Okay, so alcohol dependency develops when a person drinks so much that it causes chemical changes in the brain, and that increases the feelings of pleasure when you use alcohol, making them want to drink more frequently, even if it's harmful. When the pleasurable feelings from alcohol go away, the person with alcohol use disorder will drink in order to prevent symptoms of withdrawal. I've heard it said that people keep drinking because it's not necessarily to feel good, it's to not feel bad. So you wake up in the morning not to drink to have a good day or feel better, or whatever you use alcohol for, but you use it because you don't want to go into withdrawal. That's when you have a problem with this. So at what frequency or intensity of drinking alcohol causes one to be at risk of alcohol use disorder? So what we know is that men who have more than 15 alcoholic drinks a week, or frequently have 5 or more drinks at one time. So like dad drinks 5 beers at night or something like that every night. That could lead potentially to problems with alcohol. One drink is 12 ounces of beer, 5% alcohol, 5 ounces of wine with 12% alcohol, or 1.5 ounces of liquor, like a shot with 40% alcohol. Women, on the other hand, who have 8 or more drinks a week or have 4 more drinks at one time could be at risk of this. And again, we've got to remember, you have to drink for a long time, a lot, really, for these effects to happen, at least the thiamine deficiency. So wet brain occurrence, like I just said, for a long time. You have to drink for a long time and a lot. So then we come back to another picture of kind of an fMRI with someone with this problem with alcohol use disorder. As you can see on the left, this woman has atrophied areas of her brain. It looks like a shrunken brain. There's a lot of nerve damage in there, versus the person on the right. That woman has kind of a healthy brain. It looks vibrant. It's pretty full. It's filling in the skull there. Obviously, a lot of other factors go into if you're going to have alcohol use problems, or what contributes to having this issue. So I asked my followers, like, do you guys know anyone, or do you have a story, personal story of, struggling with alcoholism or wet brain? And one of my followers responded, first responders, firemen, and people that ride like in an ambulance. And he's not wrong. First responders, they have a tough job. They see some of the most gruesome things, and it could be traumatic. And some of those professionals, they have turned to alcohol to cope, or maybe they have, alcohol on occasion, and it's not a problem. One of my followers said her father, and I never would have guessed that about that person. And that's sad. I think a lot of us, myself included, could say, our fathers struggled with alcoholism. And I probably would say, Maria, that that's a big reason why I'm in the field that I'm in, because I wanted to help people with some of these problems. Someone said, myself, when I went into depression, and she said she's not depressed anymore, but she became dependent on it. Some people, when we get depressed, we will turn to alcohol or drugs as a crutch to cope. Maybe not feel anything. We want to kind of go numb. Maybe we do it just at parties. We have alcohol at parties. We have fun. And it starts small. It's not a problem, but it can grow into a problem. Again, your tolerance will grow if you have it on a long enough time scale, where you need more and more to have the same effects. And that could lead to dependence. Another follower said, there was times where he would see blood coming out of both ends. So he'd be vomiting blood and having bowel movements with blood in them. And he said now he's 2 years clean from alcohol. I'm really proud of him. This is a big deal. We're kind of moving into a harm reduction model culturally, and a recovery culture. And I'm hoping it's going to go more mainstream. You got to realize that the human body, the human brain, it's human nature for us to get addicted to things. If you've ever known someone with a quote unquote addictive personality, and to say someone is a bad person because they have an addiction, that's kind of looking at the human condition not in the most appropriate way. There's a great author by the name of Gabor Mate. He comes to Santa Fe sometimes to teach, and he wrote a couple books about addiction. And he says, addiction is really, whether it's alcohol or drugs, we really use addiction to fill voids in our life. He says, and at the root of all addiction is some type of suffering, whether it's feeling lonely or isolated or estranged or hurt or pain. So, what we're trying to do now with the field in social work and counseling is really move towards a recovery model, help people to get to the root of their suffering. So now let's talk about children, adolescents, and alcohol use. So the brain continues to develop well into our 20s. In adolescence, brain development is dramatic, with changes occurring in the wiring and the physiology. So the chemicals in our brain and how our brain kind of wires up and creates new connection is drastically changing and resculpting as we're in our teenage years and young adult years. During adolescence, the prefrontal cortex, or the front of the brain behind the forehead right here, undergoes significant remodeling and kind of comes online. This area is responsible for what we call executive function or higher order functions. Things such as impulse control, abstract thinking, so thinking about ideas and concepts, thinking about the future planning, thinking about thinking, something called metacognition, to be able to reflect on how do I think, or why do I think that way, or why do I do the things that I do. Emotional control, working memory, mental flexibility, rule learning, and morality. So this is really key because this part of our brain that we're talking about during our adolescent years is turning on, right? We're really having to use it. Every time we use one of these skills, it gets stronger. Those wires connect more, and they get more myelinated, what we call them. They have more connections. And so as you can see, rule learning, morality, all these things that are necessary to becoming like a really functional, happy person in society are developing during adolescence. Impulse control, not acting on our thoughts and our urges. So in large enough quantities, alcohol can be considered a toxin. We've already talked about that, which delays development. It's like if you gave a plant microwaved water on the left there versus a plant on the right, that plant would have a slower rate of growth than the plant fed regular water. For some reason, when you microwave water, it takes out all the vitamins and minerals and other what we'd call impurities in water, and it makes it less nutritious, which is really interesting. And so if you did this experiment with like pinto beans, you'd see that a plant given microwave water or you could feed it bleach or anything under your sink, and it wouldn't grow as well versus like a plant that you just fed or watered, like tap water. So our brains are like that. We're an organic creature. The same things that we put into our body either nurture us or they can hurt us. And I like this idea of a plant because our kids are like plants and we're watering them every day. And why would we give our kids something that would not help their development? You know, um, Something to think about. So not only can long-term heavy alcohol use shrink the brain, as we've seen in Wernicke-Korsakoff's, adolescents who drink heavily may experience adverse effects that disrupt normal growth, affects their liver, their bones, and endocrine or hormone development. A big part of adolescence in maturation is puberty, right? And for some individuals that drink alcohol, some teenagers, adolescents that drink alcohol, it can impact their development with puberty. And we probably want to push them forward as fast as possible to get through that. Some of our kiddos. Some research has also found in the brain that there's a decrease of the real estate that stores memory. So we talked about that earlier in Wernicke-Korsakoff's with the hippocampus. But some of these studies, they find that older age of onset of alcohol use disorder and shorter duration of the disorder were associated with larger hippocampal volumes, which means that there's less damage done. That was lessened if a teenager started drinking later in their teenage years and got off sooner, or they had a shorter period of using alcohol. So I guess this is a really hopeful message for all of us. Maybe some of us have teenagers who are struggling with alcohol use. A big part of our job is to help them to obviously look at what's driving it, but try to get them from using alcohol, get them off using alcohol, more adaptive coping skills, so their brain can start to recover some of these things that they may be damaging. And again, more real estate in this area of the brain means improved functioning, and specifically for the hippocampus, that seahorse area of our limbic system, means better memory. And I think we all need really good memory to function in life. So what's unique to adolescent development and is normal in adolescent development is teenagers have a greater emphasis on hanging out with their friends. They want to do things independently. There's an increase in novelty or risk seeking and other kind of reckless behavior. So just because maybe our kiddos, our teenagers are acting reckless or making quote unquote bad decisions or risky decisions, or they want to go do the next new thing, that's not necessarily like an abnormal or maladaptive thing. That's pretty normal for teenagers. The parts of the brain that regulate these are still developing. This frontal cortex right here, they're still turning on and strengthening. So, if you don't use it, you lose it. We really want to encourage them to think critically, to have self-reflection, because every time we use it, it gets stronger. And why this is important is because as the brains are developing, to add alcohol into the mix only reduces the development. It delays it. So, for example, our kiddos who are using alcohol are at a place in their development where their cognitive capacities are budding, and alcohol may delay the maturation effectiveness of these advanced cognitive skills. We just hope and pray that our kiddos make it out of adolescence being able to think critically, make good judgments, plan ahead, and stay on task, right? Obviously, also have a happy, healthy body. Because we want them to be functional and productive members of society, to really enjoy everything that life has to give them. So what factors place our kids, teens, and young adults at a higher risk of developing alcohol use disorder? Research suggests people who have expectations of more positive experiences from drinking tend to drink more than others and are at highest risk of excessive drinking. So it's important for us, the adults watching this, to be aware of the messages about alcohol we use, that youth receive, and the attitudes that those messages engender about alcohol and its use. I'm going to share some of these risk factors with you all, and I want you to think about them because it's not necessarily like, well, my kid has a problem, right? And as a counselor, I've had parents come to me and say, well, it's my child's problem. They're the ones struggling with this. And so we really got to take a step back and look at the whole picture. What are the other things driving why the kid or that teenager has turned to alcohol, is using alcohol? And this the research on this point puts the focus back on us as the adults, and it says, well, how have we spoken to our children, or how have they heard us speak about alcohol in their life? When we go to family functions, what are all the other adults doing? I can't remember a time in my life where I went to an extended family function, and there wasn't alcohol there. I look back at some of the pictures when I look in my parents' photo albums, and there's beers and other alcohol in every picture. So culturally, what was the message for me? Right, alcohol is something that we need at these functions to have fun, to get along, and so it puts it on us of like, how do we talk about alcohol in front of our kids? Because if we give them that expectation that it's really fun and positive, then we're also putting them in a place of disadvantage that they may turn to alcohol eventually.
Yes, thank you for talking about that, Gilbert. That is something that our coalition has been working on, is exactly what you just said, this cultural idea that alcohol is fun and it's safe, and we have it at every family function, and we're trying to change that culture. And that's part of one of the goals that we have as a coalition. So that's a really key point. So thank you for sharing that part.
You're welcome. And I'm really proud of the work that you guys are doing to change that, to shape that and mold that. Because again, what we're talking about is like a systemic problem, right? There's multiple things happening that are influencing this. And Maria, that's a huge one. What we know from, Brofenbrenner's ecological model, in terms of like what has the biggest impact on our kids and ourselves, it's our family. They're the first major influence in our lives, and then eventually friends. And what's way out here, the end of the circle that has the least influence is like professionals, which is really interesting. So to start at the home is really a key piece. So children in general shift from a primary emphasis on the negative or adverse effects of drinking alcohol before age 9, to the primary emphasis of the positive and arousing effects of alcohol by about age 13. So these researchers found by about 9 years before 9 and below, if you ask a kiddo about alcohol, they may give you like, oh, well, that makes daddy's breath smell, or mommy gets really sleepy, like really negative answers. But when you ask a kid about the age of 13, again, right at that puberty age, they will say positive things. Mommy and daddy drink and they have a lot of fun. They do a lot of laughing. When we spend time with our family, everyone's enjoying themselves when they're drinking. So right about that age, and kids are like little sponges. They soak up everything. They're always paying attention and they're observing us, right? And we shape them. We shape them, all their thoughts. Early initiation of alcohol use remains one of the most powerful predictors of later alcohol use. I was looking for a graphic of like future, and all I could keep coming up with was like a crystal ball. You can read the crystal ball and it'll tell you your future. This is a key one though, Maria, because I think for me, I remember having my first sip of my father's beer when I was like 5 or 6, and that's a really strange thing. And I think some of us would also have those same stories. Like, yeah, it was back then at least. Was it a problem? And why would my father be giving me beer to taste? I don't know. But one of the greatest predictors, most powerful ones of later use is kids start early. Earlier and earlier has worse outcomes in the future. So I guess don't give your kids a drink of beer. Relevant to underage drinking, studies show that adolescents who spend more time with peers who consume alcohol are more likely to drink. So this is why it's critical to manage your kiddos, your teenagers' peer group. Deviant and quote unquote negative peers can be a huge influence. As we know, one of the major developmental milestones and tasks of adolescence is, finding your identity, differentiating yourself from your family, and that comes with a lot of influence from your peers. And so if your peers are doing it, you're going to want to do it. Excuse me. And when we did multi-systemic therapy, and even now, when we're working with families and one of their kiddos this is their problem, they're on doing alcohol or drugs, we really got to look at their peer group and manage that, because they have a bigger influence sometimes, their peers, than we do as their parents, and that's just how that goes sometimes. So strong novelty-seeking behavior is one of a number of traits that is linked to early initiation of alcohol, ETOH, and other drug use. the level of perceived stress was found to be the most powerful predictor of adolescents' alcohol use and other drugs after peer substance use. So, like we just talked about. So, some of our kiddos, and I was definitely one of these novelty seeking kids myself. I always wanted to do something, climb something high, go jump off of something, so we got to be careful for those kids that are seeking risk and rush and stuff like that, that are kind of adrenaline junkies, because that potentially is linked to drug use. And the second point about stress, maybe someone doesn't look stressed, but their perception internally is very stressed. I'm thinking about all the kids that are going through finals right now, in a virtual classroom in the time of COVID-19 lockdown restrictions. I can only imagine the type of stress that they're experiencing. I was just talking to my nephew yesterday, and he's on his finals. And gosh, I would hate to be his age going through college finals online right now, but he's probably used to it. So, but you would definitely want to check in with our people to say, how are you doing?
Yeah, the kids are definitely struggling, Gilbert. I
Mhm.
have a lot of interaction with some of our youth here in the community, and the majority of them are just like they're saying we never thought we would miss school, and
Mhm.
that's what they're saying right now. They would rather be in a classroom than to be dealing with everything that they're dealing with right now.
It's so interesting you say that, because I'm a part of me is like, oh my gosh, we did it. We wanted kids to miss school, and it's a very sad set state of affairs to say that. You know, um, and you don't know what you have until you've lost it, right?
Right.
So we're almost done. We got a couple more slides, and we'll have a discussion. Other risk factors: high levels of impulsiveness, acting out our impulses and urges, aggression, conduct problems, violating people's rights, breaking into things, ditching school, novelty seeking, low harm avoidance. So we don't, maybe these kiddos and teens, they're not afraid of getting hurt. And other risky behavior in childhood and early adolescence may be associated with future heavy alcohol use and alcohol use disorder. So at the clinical level. What's also not on here, I guess we'll talk about it in here, is depression and anxiety, as well as trauma. Depression and anxiety are risk factors for alcohol problems because some people will use alcohol as a strategy to cope with our distress. Youth who use alcohol are more likely also to use other drugs, and vice versa. People who use other drugs are more likely to use alcohol. And again, trauma, what we know about trauma these days with like ACEs, adverse childhood experiences, is the more people have higher like adverse experiences in childhood before the age of 18, um, longitudinally over their whole life, they have greater chances of not only anxiety and depression, PTSD, but also physical problems. Um, diabetes, high blood pressure, cancer, stuff like that. Um, again, I'll reference Gabor Mate, the author. He wrote a book called The Stress Cancer Connection on this topic. And he found that people that have this like great stress as well as adverse experiences, they have greater morbidity or risk for disease and death from disease as they get older. So there's something to this, folks, when we talk about depression, anxiety, stress, and coping skills, that we really need to get nip this in the bud when we see these things and get our people the support they need before it spirals out of control. And I think overall, I don't want this presentation to necessarily be like a scare tactic. These are just the facts of what happens when certain things are allowed to continue versus like, if you do this, you're gonna die, something like that. I think we're really talking about having a good quality of life, not only for ourselves, but for our kids as we get older and they get older and we age together. So, what about genetics? Obviously, kids from families of alcoholics are at a higher risk for alcohol use disorder throughout their whole lives. Genes account for about over half of the risk for alcohol dependence, and environmental factors account for the remainder. So this is an important discussion here as well, because, for some of us, myself included, we come from a long line of people with alcoholism. And, our genetics are not a death sentence. They are not written in stone that say, your grandfather and father and the great grandfather had alcoholism. And so therefore you will have it. our genetics, just like our hair color or our handedness or color of our eyes, that's passed down. But the environment that we place ourselves in turns certain things on and off genetically. And I like that we've talked about some of these environmental and societal factors um, that are also important to consider, right? And I think it puts us as parents in a place of power to say, I'm not as helpless as I thought I was in helping to shape my kid and my community and the kids and the families around me. Um, at least less than more less than 50% we have control of that, right? And again, that's talking about messaging, that's talking about peer groups, that's talking about what we do and talk about in our families, how we use alcohol in our lives. So we as parents, um, we have control, and we are empowered to do a better job. And as my friend, one of my colleagues, she came from a long line of people that struggled with substances, and herself, and she was in recovery for a long time. And one time we were talking, and her daughter came up to her and asked her, "Mom, because my brother and my uncle and so had alcohol problems and drug problems, does that mean I'm going to have these problems?" And she gave a really awesome answer to the daughter. She said, "If you never use alcohol or drugs, you will never have that problem. But if you do use them, I can't guarantee that you won't have that problem." Pretty simple. So some of the long-term consequences of alcohol use disorder could be impairment in any and all life domains. It could turn into a vicious cycle. You feel depressed, so you drink. Drinking more causes depression and anxiety. You miss work, you drive buzzed, you get into legal trouble. That can cost money, maybe money you don't have. You got to pay rent. That causes more stress. So you drink to cope. Ad infinitum, meaning it's just a vicious cycle. If this happens for a teenager in the teenage years, think about how that would impact their school, their friend groups, being able to go hang out with their friends, have privileges. Maybe they get grounded, right? All these negative consequences could come, and they are not now living like a positive life. They're living a life of just avoiding consequence. I think we all do that, but to do that primarily is you're not having a good quality of life, if that makes sense. And again, the long-term consequences, like we've talked about early in this presentation for adults, is Wernicke-Korsakoff's and other conditions that come with heavy alcohol use for a prolonged period of time. So a developmental approach to prevention and reduction of underage drinking recognizes the environmental and social systems that impact adolescents. To succeed, it must involve all systems: parents, other adults, teachers, schools, peers, therapists, family, government, organizations, and the society itself. We need to wrap up our kids in a lot of love and care and check in with them. And if our kiddos and our teenagers are struggling with something, and they're telling us they are, then we need to get them to the right type of help. And we have wonderful programs. I know they're in northern New Mexico as well, that are there to support us with our kids or ourselves if we're struggling with some of these alcohol problems or drug problems, depression or anxiety or PTSD. Any of these conditions, there's a lot of great support out there. And I know Maria's tied into some of those. So if you need some assistance, speak to those people around you. They can probably point you in the right direction. So Maria, I think that's basically it. Let me go back to my Zoom here and unshare my screen. Let's see, stop share.
All right, well, thanks, Gil. That was very informative. We didn't get any questions on the Facebook Live, but I just want to reiterate what you said about, the environment factors and, what our kids learn is what we teach, because that is a big piece of what causes, the behavior in teenagers, children, all the way up into adulthood. And you spoke about the adverse child, the ACEs, the adverse child. What are they?
Good experiences.
Yeah, and it is really important. We, in prevention, it's different than what it is in the clinical world as far as the ACEs go, but it's similar because we are looking at those environmental factors and what it's like for adolescents, children. You know, you mentioned the sip of beer. I think that was kind of a norm. You know, we've talked about this among you and I, of how we've had, you know, our parents have been, you know, alcohol has always been present in our life. So it has been a norm. And that's just something, like I mentioned earlier, that our coalition is working towards, is trying to change those environmental norms. So yeah.
Hmm. Yeah, exactly. And you know, it's a weird thing to put the responsibility back on the parents, but it's an important thing. You know, it's our responsibility to change our culture. What kind of family culture do we want to provide? Do we want to make and pass on to our kiddos? You know, I'm a father. I'm a new father. I've been, you know, we had our daughter 2 years and 8 months ago, and you know, a couple of months, I think coming up in December, January will be 3 months that I've stopped drinking alcohol myself. And I had you know, it was a really interesting thing. Like, it's just been alcohol's been a big part of my life, my whole life. Again, family life. I've never had major problems with alcohol, but it's caused problems. But before I had our daughter Hazel, I didn't want to continue that tradition, you know. And again, I'm not taking a moral high ground of like holier than thou than anyone. You know, we all make choices, whatever those
Right.
are. And this is just the choice that I wanted to make for myself and for my daughter. And you know, it really fit in line with my other goals in life. You know, where alcohol didn't really have a place in my life. It's really an interesting place when you ask someone to defend why they use alcohol, the answers that they give us, you know. And none of us like to be questioned about our choices, right? We're adults, we can make choices. I think we all fall back on that. But to defend why we continue to use alcohol, or especially if it's a problem, you know, then it really starts to kind of erode the foundation of like our belief system of why that's important to us. And you know, we've treated a lot of people with alcohol problems, major and minor. And I think that's what's incredible about counseling and therapy. You know, you go see a counselor and a therapist because something's not sitting well in your life. And they're not there to say, you know, well, you got to get off of alcohol. You know, they're not going to tell you that necessarily. We want you to come to that conclusion yourself. If you think that it's causing a problem, you know, if it's clinically significant, you're going to come and say, there's a problem in my life. And if we get boiled down to it, and if alcohol is part of the driving problems, wow, we probably got to tackle that, you know. And so, you know, changing the culture also starts with getting support for ourselves to look at these really dyed in the wool beliefs that almost are like dogma in our lives, you know. Well, I can't stop alcohol because that's just what I do to relax. You know, we hear that sometimes. So it's a difficult topic. I'm glad we're broaching it. I'm so proud of the work that you guys are doing up there in the north with this, because you know, at the end of the day, it's going to benefit ourselves, our families, our communities, and just society as a whole.
Right. Yeah. Well, thank you, Gil. I really do appreciate you coming on. And I know it was like one of those, saw you on Instagram, hey, will you be my guest? And I really appreciate that, that you came on and did this presentation for us. And maybe we can do some more in the future. And it was nice to see your face, and give Susan my love, and Hazel as well.
Absolutely. Same to your family. It's nice to talk with everyone. And I look forward to the next time. Everyone take care, and happy holidays.
Happy holidays.